Actually, in my former video I talked about health issues, health problems which needs to be solved, like the nosocomial infection. So today in my health advice show, I'll be talking with you guys on stress management, because I've seen many people passing through stress, yes, and they are complaining they don't know how to manage their stress. So today I'm going to tell you how to manage your stress. Yes, because you can't avoid it, but you can manage it, of course. So don't forget to like my show, my stream, like it, follow, and save this video for a future reference.
Every day is a gift to pay.
Okay, welcome back. It's Maria, Dr. Maria. So today I said we'll be talking about stress management, because a lot of people have been passing a lot of stress. So first of all, this our stress that we are passing through has led to people a lot. Yes, people are committing suicide because of stress, of course. Yes, and if you look at in our world today, we see that 3,599 million people pass through this stress I'm talking about, and majority of them have no idea of how to manage their stress, which has caused them a lot, even made them separate and even leave their families members. Some of them end up on the road. Some of them even they don't know what they are doing. Okay, so now what does this stress has to do with, like, what is the meaning of stress? Because many of us don't know what is stress. And stress is a natural reaction, just a natural reaction of your body, and it has when changes or challenges come in plague in your body system, and you face a lot, because it's a system thing, because the body has to do with your body system, of course. And I say it's a natural reaction, like I said before. So now, which also affects the mental health status, because that is why it's very, very important for us to manage our stress, because once the mind is affected, all parts of the body is being affected, because it's from the brain that controls every other part of the body, brain and the heart. So imagine if your mental health is unstable. You know what that means. A lot goes in your... Okay, so this stress, like I said, it results in physical response and also emotional response and also behavioral response. That is when I talk about the mental state, because when somebody is passing through stress, the mind is affected. That is why it results in mental health problems. So once it results in mental health problems, there is a physical response problem, there is behavioral and also emotional part are involved. So now also, this stress, it can also help. It goes in physical way, it goes in positive way or negative way. So when it is positive way, means that it will help you to keep alert and to avoid dangers. But it can be negative in the sense it becomes a problem. Okay, so I said stress can be a problem. That is when it is negative, when the stressors continue to experience relief, like when the relief is not relaxing. Yes, when the person is not relaxing the period of time, that is when it can be negative. And I said it can be positive as well. That is, it helps to stress also help you to stay alert and avoid dangers. So now, types of stress. We have a lot of types of stress, because a lot of people don't know where they are based on. in the type of stress. So we have acute stress. Acute stress, that one that comes and go. I'm sure majority of people are placed on that acute stress. Like for example, children, I can say students in school. Yes, students in school can be placed on acute stress because their own they come and go. Maybe when they other type of stress we have is episodic stress. Is another type of acute stress. That one comes regular basis and it's cannot be controlled. Yes, it occurs negatively, it comes positive or negative, and it cannot be controlled. Then we have another one that is very important that many people are being placed under. It's when they come for counseling or consultation in the hospital, and that one is chronic stress. Yes, a lot of people are placed on that, and such people are the bankers. They're placed on that stress. Marriage people that are married, couples, they are also placed on it because they pass through a lot of stress at home, in the bank, at work, and and also those who face financial problems, they are also placed on that too, because chronic stress is this type of stress that is a long. Okay, and we also have the symptoms and causes of this stress. So what are those symptoms? There are many, so I'll just list them because we need to know about it, so that when we have these symptoms we can be able to track if it is stress that is occurring to us. So one of them, we have the heart rate. Yes, that is heart rate. Vision, you start having vision problem, you start having breath problem. Yes, of course. You have physical symptoms, we have emotional symptoms, we have behavioral symptoms. Under the physical symptoms, we have chest pain, we have aching, that is, you have stomach pain, dizziness, trouble while sleeping. Of course, we have stomach pain, we have muscle tension. Yes, you also have high blood pressure, which is the majority thing that people are having right. High blood pressure is the majority thing that people are having whenever they come to check their vital signs. Their high blood pressure rises, they have high BP, and it's due to this stress which they place them on drugs. But it's for us to know. Make sure you always check your vitals to be sure. So also we now talk about the psychological problem, that is psychological symptoms. We also that one also is a major key where they place people on. And we have the anxiety. Yes, anxiety, depression. That is why I say when someone has stress and it's not taken care of, the person can commit suicide. And that is why it's good for us to know what kind of stress we are passing through. So some are also placed under psychological stress, that is symptoms, because majority of them have anxiety, depression, pain attack. Have the behavioral problem, that is behavioral symptoms. And under the behavioral symptoms, we have, that is where many people are placed on that problem, which is those on alcohol use, drugs, substance abuse. We have overeating. Yes, the person begins to overeat. Those ones that eat, obesity, gambling issues, disorders. We have smoking, also substance abuse, like I said, a disorder. Then we have what can cause this stress. There are lots, like marriage problem, a divorce. Maybe the husband and wife are divorced, so they begin to pass stress, start thinking, mental health issues. Financial problems, maybe the person lost his job and he's having crisis on payment bills at home. Then we have retirement. Maybe someone has retired, so he begins to face stress, does not know what to do again. He becomes stressed at home or confused at home. Then complications, we have complications. Under the complications, we have immune system. That is the immune system. One of the complications we have is arthritis. Yes, the person have arthritis. Then we have digestive system. Under the digestive system, we have ulcer. The person need to have ulcer, weight loss, weight gain, irritability syndrome. Then we also have cardiovascular system. Under the cardiovascular system, the person begins to experience high blood pressure, like I say, hypertension, which is a major key increase in heart rate. Then we have a reproductive system. Under that reproductive system, we have infection. The person begins to develop infections, yes, and also infection like this polycystic citric organ fertility. The person cannot produce a child. You begin to have issue to give birth to a child. They cannot produce, especially the male or the female. It can be the male, it can be the female. So we need to be careful of this. This infection I talked about. Also, I said it's also based on ovarian. That is ovarian syndrome. Yes, like when I said the person begin to have problem in to give birth, and is a female that suffers a lot. So now we'll be talking of the stress management. How will you manage your stress? Because after hearing all this, your mind will be like, oh, I'm placed under acute stress. How will I manage my acute stress? So how to manage those types of stress for management? There are a lot. So I'll just give you the main ones. And one of them is you need to do a physical activities like exercise. Go for exercise. Go out for walk, jogging, yoga exercise. Or you seek for so you can also seek for a therapist, like I said, a counselor, or seek for consultation. Then you can also do breathing exercise. Of course, breathing exercise. You can also have a positive mind. Always have a positive mind, not negative mind. Always be positive, and also seek for connections like from friends, relations, families. Connect with them. Have a positive mind. Make friends. Then you can also have a good sleep well, have a good balanced diet meal, because it helps ease the mind. And also you can go on nutrition diet, so that take a lot of fruits, which helps the mind to ease the mind. Then there are other ways for management. For stress management. I know stress management, it helps you to deal with your stress. Yes, it helps you to deal with your stress. So in other management, you can alter in stress, you can adapt to stress, accept the stress as it is. Then you can also avoid stress. You can avoid it, or you stay active. So thank you everyone, because I'm sure you have learned a lot. Yes, or how to manage your stress and what stress is all about and the management for it. So please don't forget to like, share, save this video for future reference, and I'll see you in my next video.